Join Doctors Savanah Craig and Ronnetta Sartor as we navigate life beyond graduation. Real conversations about forging our own paths in our early years in our careers. There's a reason it's called practicing dentistry. Welcome back, everyone, for another episode of Beyond Graduation. I am Savanah Craig, and with me, as always,
it's Ronnetta Sartor. We're glad to be back.
So we are rounding up season 2 here, and so in the idea of we're coming up on Thanksgiving and Christmas and all of these things, we thought we would talk about the ways that we volunteer and give back, because dentistry can be stressful, but we're really blessed to be able to do what we do. So we both have a passion for using those skills we've learned to give back to people in the ways that we can. Ronnetta, what does giving back look like to you, and how have you been giving back since dental school? Was it more a residency thing, private practice? How has that changed throughout your time?
I feel like I've been giving back for as long as I can remember. I remember being really young and going to church with my grandmother and doing stuff at church. When I got into undergrad, we had an organization called Impact, and we would do community service of different types all over the Spartanburg and upstate South Carolina community. And then in undergrad, I pledged a sorority too. And as everyone knows, lots of sororities aren't just about all of the fun, but more than anything, they're about community and giving back. So I'm still a part of that sorority and everything too. So I still give back as it pertains to stuff like that. But from a dental perspective, I still give back as well. We did the same residency program, so it was a part of being a resident.
Mm-hmm.
You had to volunteer at the children's clinic and the adult clinic. It changed a little bit when you got there, but when I was there, we also went to the VA and serve the veterans, which was amazing to do that as well. I still volunteer at the children's clinic a few times a year, so that's fun.
Shout out to Mama Donna.
Yes, love her. And Dr. Stockton too, because she kind of is over the whole thing.
Yes.
But also, in our office, we give back a whole lot. One of the fun things that we do every year is school screenings at one of the local elementary schools, and which is cool. The school that we volunteer at has a school population of over 800 children.
Whoa.
And so, of course, parents can opt out if they don't want their kid to be seen, but you'd be surprised what you see in the schools. And it's super important because you hear that statistic all the time that the number one reason that children miss school is from dental related things. So
when you do the screenings at the schools, so I'm guessing it's more just like an exam, and this is what needs to be done, and then where do the kids go for treatment? Do you send them to the children's clinic or to?
So I think if where I volunteer for the children's clinic and where my office were in the same county, I probably would be able to do that. But the way that the forms are pretty much is 3 boxes. If you don't see anything, you can check that and just recommend that they go for, their cleanings and everything else. The next box says, okay, I see something that could be an issue. When you get time, schedule the child for an appointment. And the last box says, I see something that's urgent and you need to get them to a dentist ASAP.
Gotcha.
Our office information is listed, but I think the school also has resources based on the family's specific needs and everything.
Sure.
But it's pretty cool because you'd be surprised how many people and how many kids have not had pain, but you look in their mouth and it's definitely stuff going on. But we also on that form leave space for like anything else we might see. So if I see that a kid is like possibly congenitally missing a tooth, or if
Yeah,
they have really bad crowding, I'll write on that form, that they may want to have an orthodontic consult, because maybe no one's ever told them, or maybe the kid just has good teeth but hasn't ever went to the dentist.
totally.
What about you? You do some really cool stuff, and you have been. So, can you tell us about your journey from, as when you could first remember giving back to now?
Oh man. Similar to you of, church, and I went to a Catholic school, so it was very much ingrained in the community, and we gave back a lot through that. And so then definitely continued service in various ways through elementary school, high school, college. I also was a part of a sorority, so we had philanthropic endeavors, but I also would do, we called them alternative spring breaks, where you could give up your week of spring break and go volunteer in some sort of
I did
aspect.
the
So,
same thing.
yeah, those were super fun. Um, so, yeah, it's always been, I don't know, just a part of my life to give back in whatever way that I can. And our residency, like you said, was super big on, I always hear in the back of my mind, like, you've been blessed to have this career and these skills, so you should use that to bless others in whatever way that looks like. Um, but I really, really loved hospital dentistry in residency. That was sort of a big part of why I wanted to do a residency, was to use those skills to help special needs and this population of people that it's really hard for them to get care. So I loved that aspect of the our residency and the OR, and I think it's just so fun to like only focus on the dentistry. You know what I mean? So there's somebody doing the anesthesia and you just do the teeth thing and get out of there. So it was important to me when I left residency to figure out a way to continue doing that. And it's not the easiest uh, a thing to do. Being a dentist in a hospital system is challenging, but I found a residency that I had applied to when I was looking to get into residency myself, and I, had a really great connection with the attendings and those sorts of things. I went to South Carolina, but I contacted them when I moved back and said, I really love going to the operating room and treating patients, and I know that there's a need for more people to do it. I can't figure out how to do it on my own. So I drive down to Cincinnati once a month and treat special needs patients in the operating room under the UC Dental Health AEGD program.
That's great. That's
Yeah.
awesome.
Yeah.
What's that experience been like for you so far?
It's it's sort of complicated because I'm driving from Columbus to Cincinnati. So we're still working out the administrative side of all of this and what is most convenient for checking all the boxes and getting patients seen. But any more patients that can be seen in a year is better.
Right.
So it allowed me to take over one hospital session a month and give time for the other attendings and residents to add more OR dates. So that's awesome. In the beginning, I went down with the other attendings and, we worked together because hospitals are confusing places to get around. Being a dentist in a hospital where nobody knows who you are is a little bit overwhelming. So they were very awesome in like getting me up to speed slowly. So now I'm going myself with, they had a resident who was in the program last year and she stayed on as an attending. So her and I go together on Wednesdays, which is great to have
Mm-hmm.
somebody else who knows what's going on, because the nurses and dentistry is not a part of the healthcare system, and that's a whole other topic. But it's nice to have another set of hands to, okay, can you go grab me a Tafelmeyer? Can you get this, that, the other thing? But as you know, but maybe a lot of people don't, the patients that we take to the operating room really are unable to even get a set of x-rays in a traditional dental practice. So we have no idea what we're getting into until the patient is intubated and under an anesthesia. We take all of our x-rays, we do our exam, and we determine what treatment is needed. So it can be anything from a 20-minute prophy to full mouth extraction to a combination of 10 fillings and 10 extractions.
Oh yeah, those were. I remember those being fun days, but you also don't know what time you're going to get done because
Exactly.
you have no clue how long it's going to be.
Yeah. And they're, typically medically challenging patients. So anesthesia and intubation and those things can be challenging. So it's always very funny when you have a new sort of OR team and they're like, how long is this going to be? And I'm like, as soon as I know, I will let you know, but I have no idea till I take these x-rays. And I think that's challenging because they're used to an appendectomy takes as long as an appendectomy takes, barring any complications.
Right.
Um, but yeah, it's a lot of fun, and the plan is at some point for me to be able to start taking residents with me, and I have a different set of training because I went to Prisma, so to be able to share those skills is really cool.
And that'll be really cool because with working with the residents, you'll be able to learn too. Like, um, I, I've never worked with another dentist or like been in the same room with another dentist talking about dentistry that I didn't pick up some pearls from.
Totally.
Yeah.
But it's super funny because typically when I go with the other attending who's newer, we'll do split half the mouth, and there are times where giving her pearls on extractions because she wasn't super comfortable with surgery, and we laugh because she's like, how do you know how to do this? And I think back to being myself as that like new resident and being so afraid to pull teeth, and now it's my favorite thing to do. So it's really funny to look back on those things. And but yeah, I think giving back is super cool, and the parents are and caregivers are super grateful. So
For sure. I think another area of giving back that we maybe didn't even really think of as giving back is, but you kind of touched on it, is mentoring
yeah,
and that sort of thing. So the cool part of having my own practice has been the amount of young people who are interested in dentistry that ask if they can come to the office to shadow.
that's so
Right now,
fun.
and it's really cool because I had one of the local high schools reach out for. Right now we have a student that's doing an internship with us.
Whoa.
And so she comes every Tuesday and Thursday morning, and she's super bright, and her energy makes me excited for dentistry all over. But she's interested not so much in being a dentist, but in hygiene, but also how a dental office works. And I feel like, yeah,
You take
that's
for
the
granted.
right. You take for granted it, like some of the questions that she has, very intuitive, and it's just, yeah, it just gives you a new excitement, and makes you reflect on what made you want to get into dentistry, and just how much we have to offer people with the talents that we've been given.
Yeah. We all were that person at some point. You had to have your shadowing hours, so that's so cool. And that's so special because those early interactions with somebody who's willing to have you come to their office and get excited with you, I think can really shape someone's career versus having those dentists who are not happy in their career can really just squash that dream.
And we've had some high schoolers come through and we're just like, ask us anything, you can watch what you want. And some of them have said, yeah, I think I want to do something in healthcare, but I don't think it's dentistry. And that's okay too, right?
Totally.
I would rather them know now than to go through the rigorous process of getting into dental school and then get
Mm-hmm.
there and then realize this is not what I want to do. So, yeah, it's been really interesting, but we keep in touch with them and they tell us what they're doing and we're super proud of them.
That's super cool. I think that's reminds me of the biggest part of like giving back, especially in the dental field. Giving back in general just reminds you how grateful you are for your life and all of these things. But I think, like you said, giving back with dentistry reminds you of the excitement and
Hmm.
why you wanted to do this, because not every patient, but some patients in your regular everyday can not be as grateful as you want them to be in some aspects. And so I think when you're giving back, people are very appreciative. Even if the patients aren't, the other people that you're with can give you that energy to keep
And
doing this.
I think that kind of ties back into what we were saying about ourselves too, right? So you and I always talk about how I have like a gratitude journal.
Mm-hmm.
And especially on those hard days, it means even more to come home and write in that journal because it helps you reflect on what's going good
Yeah.
and not so much on what could have went better.
Yeah, I think that's a really good point, because you can get in the weeds
For sure.
very
For sure.
easily.
It's easy to do. It's easy to do.
Yeah. But I think, I don't know, I've started recently, especially for me, I think in the OR, because you're not focused on patient management or anything else, I find myself just being like, this job is so crazy and cool. The fact that I just take this drill and I take out the decayed part of the tooth and then fix it, like on such a minute level, that's crazy. The fact that we can do that is wild.
That reminds me of one of my cutest little patients. She's 5 years old, and show tell do right with her first dental experience.
Yeah.
So I pretty much described a procedure to her as magic.
Right.
So I told her I was getting rid of the bad bugs.
Yep.
And once I got rid of the bad bugs, I was going to paint her teeth and then shine my light on it like
Mm-hmm.
Disney and magic. And once I shine my light, it's brand new.
Yeah.
And it blew her mind and it blew my mind that I even came up with that to tell her. And I was like, but essentially that's what we're doing, right?
Yeah.
Yeah, that's what we're doing. It's magic. We fixed it.
Exactly. And there's not a lot of things in life that are sort of that cut and dry of, we'll just take out the bad part, it'll be all right. Like, I don't know. Not every day do I have that like eyes wide open magic of my job, but sometimes you're like, this is actually really crazy that I do this all the time. So I think that's a great way to wrap up dentistry and giving back, and just finding those little pieces that remind you how lucky you are to get to do this and have the ability to do what we do.
Yes, and I think one of the important parts that we kind of came to is that it does not have to be dentistry related. You're giving
Mm-hmm.
back. It could be
Mm-hmm.
giving back to your community. It can be mentoring. It can be whatever you deem as your way of giving back to society, but also giving back to yourself too.
Mm-hmm. Yeah. Well, let us know what everyone else is up to and the ways that you're giving back and finding gratitude and enjoyment out of life, because we are blessed to be able to do what we do. So let us know what you're working on, and we'd love to hear from you.
Thank you for joining us for this episode of Beyond Graduation. If you enjoyed this week's episode, be sure to share it with a friend. Connect with us on social media, Savanah Craig, DDS, and Dr_Sartor. And remember, you are not alone on this journey.
This episode was sponsored by the Dental Residency Guide and the Beyond Graduation ebooks. These ebooks can be found at ignitedds.com/ebooks.
Thank you so much for listening to Beyond Graduation, brought to you by Ignite DDS and Future Dentists.